area that's also affecting you. But lastly and most importantly are the bad skincare practices that you have. So tips for healthy skin: you need to wash your face, you need to block the sun, improve your diet, stay hydrated. I think we all know these things, so I will move on. You should also sweat it out. Regular exercise is good for the skin. Cleanse and exfoliate, eat vitamin-rich foods, antioxidant-rich foods, carrots, leafy vegetables. We eat vegetables a lot here, and we tend to overcook them. So please don't overcook your vegetables because you're missing the good things that you can get from it. You can also use topical vitamins, and then we wear protective clothing and hats. So let's get to the main thing, which is xerosis cutis. It's commonly known as dry skin, and it's a condition where you have rough, scaly skin. Sometimes it could actually be cracking as well. It's caused by the factors that I've already mentioned, environmental being the main one, cold weather, hot weather as well, but frequent bathing as well. And then you have other conditions like atopic dermatitis that give you dry skin, hypothyroidism, ringworm, which is your tinea infections, psoriasis, and malnutrition. And dry skin itself is linked to a decrease in the oils. We're blessed with natural oils that are present in our skin on the surface. So these are the various causes. I'll pick out the ones I haven't already mentioned. Vigorous towel drying, overbathing. Here, because we are in the hot tropics, we tend to have our bath very frequently, but it's also deleterious. Shouldn't bath too frequently. But then even if you bath, maybe just pour water on yourself and don't use all those funny things that we use, and I'll come to some of them. Dehydration, extended sun exposure, and the elderly. We all have our grandparents, older aunties and uncles, and after a certain age, 65, we see them all complaining about dry skin. I have a patient who's 95, and he's sitting there at home and he's itching. I have to go and do a home visit, but they're so frustrated because he's itching so badly. So dry skin can really be very terrible in its severity. Diabetes is also a risk factor, making the older ones more susceptible. A type of skin condition that you have in the elderly is eczema craquelli, which is a common pruritic dermatosis, characterized by dry, cracked, scaling skin, and it's also inflamed, very troublesome as well. And it has this crazy pavement, which I will show you pictures of. It's caused by epidermal water loss, worsened by the dry skin. In our environment, the dry weather is a harmattan, usually, but in winter, in other temperate countries. Then your medications. So another thing too, when you're clerking patients, when you're asking, what's the cause, you're trying to find out the cause of the pruritus. You need to, the cause of xerosis and pruritus, because they sometimes come along together. You have to find out their drug history. Some of the drugs play an important role. Aging, as you age, your sebaceous glands are also reduced. And then less common cause is radiation. Some of the elderly people too are also having radiation therapy, nutritional deficiencies, hypothyroidism, and of course the malignancies. So how do they present? They will present with dry, itchy, scaly skin, especially on the arms and the legs. It feels tight. And after bathing, they tell you that their skin feels really, really tight. Sometimes they have this white flaky skin as well, and fine cracks. So if you look at the pictures, you can see on the left where you can see the dry scales. Here it's getting a little bit worse. And then here you can also see the pavement, like we've already mentioned. I talked about the crazy pavement. There's some pictures coming up of patients. I'd be grateful if you wouldn't record. Thank you. Here it's more obvious. You can see this is now even moving towards ichthyosis. You can see the pavement style. There are other conditions that may present with xerosis, and I've mentioned some of them already. Atopic dermatitis. So you see the young child, you see the lesions in the common area to the antecubital fossa, and there is dry skin. If you don't use an emollient, if you don't sort out the dry skin, the atopic dermatitis is not going anywhere. And then of course, it's looking a bit more advanced here. And then this is where it now is involving more than the areas of involvement of atopic dermatitis. So you can see they're actually presenting with erythroderma. More than 80% of the body is affected. And you can see it's dry, it's scaly, and there's a lot of skin. So the underlying condition is atopic dermatitis, but xerosis is something that is very important. I put up this particular, these pictures, because it's a common thing that we find in our environment. Then anybody that wants to try and tell me what this is, none of the dermatologists, any of my young doctors. There's some very new doctors in the house, minted, when they say they just graduated. They don't want me to pick on them. Okay, just one of you try and tell me what this is. Don't let me call you out. Don't, you should know. Let me help you. Herald patch. Is it? Don't let me down. You forgot your dermatology already. Herald patch. Yes, speak up. Pityriasis rosea. This is a common viral condition, but it also presents with dry skin if it is very widespread. So why I put it here is because they also need emollients. So just to say that, the dry skin comes up in different ways, and emollients are very, very important. And in this picture, so this is pityriasis as well. So this person, even if you don't know what it is, above all, do no harm. So above all, use emollients, because that skin is scaly and needs the emollients. That's why I put it in. So for the management, it's history and physical examination, evaluation, and the treatment. I've mentioned this already. Sometimes you have fissures, you have cracks as well, and there can even be bleeding, severe bleeding from the itching as well. So you want to, your diagnosis is based on the presentation and what exactly the underlying cause of the xerosis is. You only do a skin biopsy when you're uncertain of the diagnosis. So in terms of treatment, we start to use oil-based emollients twice a day. I tell patients, when I really want them to understand what I'm saying, I tell them QDS. So the same way you use your paracetamol 3 times a day or whatever medication you're taking to, I say your emollients is 3 times a day. So get a little container, put some in your bag, you're at work, it's time, put the timer on your phone, it's time to step into the bathroom and oil, do that, because that is the treatment for your dry skin. If you're staying in the office all day, morning to evening, the air conditioning is on, it's only going to make you drier. So you must top up, and that's what I tell them, you must top up. Sometimes we need to use topical steroids, and we start with low potency steroids before we move on if we need to. There's also the importance of differentiation between using a cream and using an ointment. So advice for moisturizers is very, very important. Within 3 minutes after you have your bath, tell them not to towel dry. You rub the towel, pat dry, leave a little bit of water on the body, and then slap on the cream. Be generous. It's like you're drinking water. When you're thirsty, what do? You might not even use the glass. You just take the bottle and you gargle it down. So when your skin is dry, it also needs to be hydrated. How will you hydrate it? Slap on the moisturizer. So it's not 3 to 4 times a day is what is very important. The ointments are the best. So simple Blue Seal Vaseline jelly is great, and then the creams come after that. And you use the 2 pari passu so that you can get the best effects. The lotion for mild to moderate dry skin and for the face, because you can't exactly put the ointment on the face. Other things which you can use, pimecrolimus, use warm soaps, alpha hydroxy moisturizer, and then these are some other things that we think of in emollients when they're looking at future treatments. The palmitoyl ethanolamine. Now, what measures should you take? You can't always prevent the dry skin. It might be due to drugs, depending on the underlying thing that is causing it. But as you age, it's inevitable. So you need to take some steps so that you can improve this. So what do? You modify your daily routine. As I mentioned earlier, 3 to 4 times a day, you should use your emollients. Avoid bathing or showering with very, very hot water. That's not good for the skin. Take shorter baths. Some people love to, you soak it in, get into a bath. That's if you're using a bathtub. But even if you're not using a bathtub, some people can let the shower run and you're just enjoying yourself in the shower. That's the truth. But it is deleterious for you when you have dry skin. Avoid excessive water exposure, extended times I've already mentioned. And then gentle soaps. Gentle, things that don't have a lot of fragrances and a lot of chemicals that can cause irritation to your skin. And of course alcohol, because alcohol in these products is drying. I've already mentioned some. Limit the use of soap for the areas that are particularly dry, like the legs and the arms. Avoid scratching as well. Oil-based moisturizing lotions, and you'll hear all about that from Topicrem, which incidentally, is one of the good products, excellent products out there that you can add for your dry skin.
Sorry for the interruption, but the security has asked me to tell JJJ Mazda JJJ 433JD, phone number 080-230-84711. So please listen to this, please. Thank you.
Use sunscreen and use a humidifier, at home. The prognosis for xerosis, it's good. It responds to treatment, but you have to bear in mind, they want a one-stop fix-it-all. So you also have to educate them so that it's recurrent. And when they do the do's and then avoid the don'ts, you see that the relapses will be less. And when you educate them, then they understand what they need to do, avoiding the triggers, maintaining the proper hydration, which is part of long-term management. The bad skincare practices and also misdiagnosis also plays a role in how we manage. The use of antiseptics and disinfectants, and we have the champion here. Well, we're all champions, but there's a lady in the corner there who's written and talked about use of disinfectants, and if you check her on social media, she's always telling you that's Dr. Adeyefeko. Antiseptics and disinfectants, if you're using them here, please stop. They're bad for you. You don't need it. It's bad for your skin. So it causes dryness of the skin. You can have contact dermatitis, there's irritation, there's allergy. It also causes hand dermatitis. They play a role in established skin infections. And a disinfectant, please, I need to remind you of the role of a disinfectant. It's useful in keeping clinics and hospitals clean, not your skin. So we don't recommend it for daily use or prophylaxis. The skin thrives when the balance is not altered. You are altering the balance by using it. So I put this here because we all know what these naughty things in the middle cause. When you don't know what it is, it's better you seek the advice of a dermatologist. Stop the use of these products. They don't solve the problems. And this is what they give. And when you've finished using all those horrible products, then you come to us and, this is what we have. So topical corticosteroids, potent ones, is being misused and abused. Please, no pictures, madam. Thank you. Then this is the effect of using topical corticosteroids. You have the normal flora, which may exist, Candida, now there's an overgrowth. And then it's repeated. They use one, it didn't work, they use another one, they go to another place, but doctors use another one, and it's just continuously being used. And we all can see in social media and everything else what the use of topical corticosteroids do. This is what it is. And then they keep telling you, oh, I have eczema. It's eczema. Okay, this is what happens, and it's not properly treated. Look at this gentleman's face ruined by topical corticosteroids. This, acne. There's nobody that's here that isn't affected, that hasn't had it, hasn't had a sibling, or won't have, and blah, blah, blah. And it's very important. It affects their quality of life. They're very bothered. And in this generation, I know that every single one here will also know that social media, TikTok and co are not helping. They're good in some ways, but they're really not helping because they've gone there. They'll come to you and they say, hey doctor, I've used this, I have a skin care plan. And the skin care plan is great. All the things they're actually showing you are not bad things, but it's too much. They don't know how to use it. They're using niacinamide, they're using this, they're using that. At least 10 products. They will have the young ones. And, they trouble, I have one, so I know. My son went through myself, Dr. Trafonera, and Professor Yolo. He says he can't have a mother that's a dermatologist and can't fix him. It wasn't until Professor Yolo. We've been telling him the things all along. But that wasn't good. So Professor Yolo took another angle, and Professor Yolo was now the darling of, myself and Dr. Trafonera were not. And he will send me things, Dr. Pimple Papa, I'm going to use this, So where am I going? Social media is there. So we can debunk things. We can also say, you young doctors, use the social media to say the good things and the bad things. But at this point now, they use topical corticosteroids, and this is what it gives. And it's very problematic. So good skincare. Sunscreen. Sunscreen. We're preaching it. Social media is helping us here now because in the past, social media, sunscreen use was more for the Caucasian skin, but that's everybody knows that everybody needs sunscreen. And so even the formulations now are more in line with our type of skin, which is Fitzpatrick 4 to 6. It's also in line with our weather. So it's lighter. There are many of them out there available and good for us. So we must use it all the time, every day. So what does it do? It decreases the risk of developing skin cancer. And in case you're wondering that do we have skin cancer or don't we have skin cancer, we do. They're convenient and easier options for use. Added protection because of the ozone depletion. Keeps you looking good. Photoaging is combated. Keeps you looking young, slows down skin aging, and is used by all skin types. I'm just going to skip through this. Just remember that whether it's a cloudy day or not, the UV rays are still coming in. You're sitting in your car, driving in your car, lots of traffic, but you're sitting there, you've got your air conditioning on, the rays are still coming through the window. So top up and use it frequently. I put this in here because I wanted to talk about hand hygiene, and because it's also another important way, for people to get dry skin. Because of the repeated washing of the hand, it strips away the natural oils of your skin. So you must remember this. So when you hand sanitize, you wash as well, you can moisturize afterwards. That's what we want to encourage. This has already been repeated. So the effects of repeated hand hygiene, you see the skin is dry, becomes itchy, and becomes irritated. So what you need to do is just moisturize after you do that. So as healthcare practitioners of whatever cadre we are, we need to be aware, we need to be informed, we need to inform, we need to educate, and we need to counsel. We need to ensure that we, first of all, it starts from us. And the dermatologists already speak the language because we all ensure that our skin looks good. So every doctor too, it's not just us, every doctor, every healthcare practitioner should have good skin. So you practice what you preach. As a pharmacist, as a GP, you want to talk to the person, and you're talking about good skincare practice. You yourself have to imbibe them so that your skin looks better, and then that way you're able to influence them better. It's teamwork, and we also need to establish referral connections. This has been very helpful over the past decade, where we're working together, and they no longer say, okay, they can't find specialists and things like that. We can also have patient information leaflets, Mrs. Oyele is here, she has some leaflets on sunscreen, she has some leaflets on acne. We have leaflets that, we can work in conjunction with the dermatologist, and we have these leaflets that, educates the patient, because they just need the information, the right information. So this is another one, the continuation. How can I prevent dry skin? How can I, that's repeated, sorry. So, in a nutshell, I've tried to talk about xerosis, but also highlight the skincare practices, the good ones that we should abide. And I've also talked about the things that we need to cut out, we need to stop, we need to erase, we need to delete, and make sure that we're practicing good things. Thank you very much.
Oh, thank you so much. Thank you very much, Dr. Kinkubu. It was another round of applause for Dr. Kinkubu. I found this to be extremely informative because this skin, as she has said, of course. Can we have the lights on, please? Thank you. Great. So that you're not talking to a ghost. So the skin, of course, is very important, and she has said is that, the skin is one of the first things that people see when they encounter you. You might say that, but beauty is more than skin deep. And you might have a very good heart, but the heart is not the first thing that anyone sees. So you have a good heart, but you're walking around Lagos with your skin looking like a kilishi, hard, dry, cracking, peppery. About hot water. Can somebody speak to Nigerian grandmothers about hot water and babies? Because we know that if the hot water has not been fetched from the nearby volcano, Nigerian grandmothers are not going to bathe that baby. But I think we said that either somebody has had acne or you will have acne. Me, I will not have acne in Jesus' name. I will not. I will have acne. So, they say, don't bath too frequently. Morning and night, minimum. That's what people do with sponge and soap. The problem with moisturization, more than once a day, and she has recommended that you should moisturize at least once a day. I mean, how many of you people, I mean, apart from when you don't leave the house, is it possible for you to leave the house and not take a shower? If you've left the house this morning without taking a shower, please raise up your hands. Let me know how about security to pack you. Because yeah, we are in bathing culture. If you don't bathe at least twice a day, some people feel like you don't bathe at night before you go to bed. Like, are you not living in Lagos? Didn't you walk around? You have to think about that. But too much bathing is problematic, as she said. Antiseptics, we know that is something that we all do. We want that water to smell like the antiseptic, but as we've learned, it isn't the best thing to do. After showering, you're supposed to, pat dry and not rub dry. But I mean, some people, if they could use sandpaper to dry themselves, they will rub themselves dry. So these are all the mistakes, common mistakes that we tend to make when it comes to skin care. So a round of applause once again for Dr. Akinwumi. That's very informative. So of course, I would just like to acknowledge the presence of Mr. Joseph Ude, MD of Jove Pharmaceuticals. Thank you very much, sir. Thank you. Thank you for gathering us together for this very informative session. And then of course, Pam Josephine Ehimen is also here. Pam Josephine. Yes, thank you very much. Fantastic. Thank you so much for joining us. Okay, so the next presentation the next thing on the agenda now is the tea break available. So we'll move the tea break. So we'll have a presentation, a Topicrem presentation, which is the main event, with questions and answers. And to do this with us is going to be Celine Roy. And I see Celine, I want to say Celine Dion, but this is Celine Roy here. Thank you. I agree. Round of applause for that. Thank you. Thank you, Celine.
Thank you very much. Good afternoon, everyone. Thank you so much for joining this session. I'm very happy to be with you today. Anne-Sophie already introduced myself, but I would like to do it again. So my name is Celine, and I am the International Trading Manager for Topicrem, and I am really, really delighted to be with you this afternoon. So, without waiting anymore, I would like to start this training session by just give you some context about Topicrem and how we are developing our products. For every product that we are developing in Topicrem, we are actually following the 7 pillars of our expertise that you have actually here. And these 7 pillars are really the key for each and every one product that we are developing. Meaning that for each and every one product that we have to respect these 7 pillars, just like the most rigorous charter. So for every body care or face care, we are providing 24 hours of hydration to provide this moisturization, this protective moisturization, which is really key, of course, just like we have seen in a previous presentation, but also to ensure the respect of the skin barrier. The second pillar is also, of course, through the choice of our ingredients that have to prove they are efficient, but are also here to have the highest tolerance. As you must know, Topicrem is really dedicated to all sensitive skin. And today we are very pleased to say that we have on average more than 88% of natural origin ingredients, because when it is possible, we are always going to choose this kind of ingredients. Once we have chosen these ingredients, of course, we have to try our formula, and the formula has to be clinically tested, at least dermatological control. But depending on our product, products, we are also conducting pediatric control, ophthalmological control, or even gynecological control. And always, always, always on sensitive skin. And until now, as you can see, we have been tested on more than 3,000 sensitive skins so far. What is also very key for us is that our product must be scientifically proven as efficient and approved by patient. So this is why we are working with more than 12,000 healthcare professionals, pharmacists, dermatologists, GP, pediatrician, and so on. You and I are working in a partnership to be sure that our products are really well working and that on a daily basis you see how they are improving our patients' life. The fifth pillar is maybe the most important for us because this is also the way how to differentiate ourselves from the competitors. Topicrem is what we call a feel-good dermatology brand. What is behind that? We are strongly believing that when you are applying a Topicrem product, we are going to bring you a positive energy that feels you more confident, more smiling, and of course for the people with such pathologies such as atopic dermatitis, it could be acne, it could be of course such as dark spots, you are going to feel much more confident, smiling, and embracing life again. So this is really what we want to do. And so far we have 95% of the volunteers saying that when they apply our products, they have a positive emotional impact. Of course, we are a French brand coming, just as Anne-Sophie introduced to you, from a pharmaceutical laboratory called Mayoli. And this is also leading us in our excellence and quality requests for each product that we are developing, and so far from 30 years now. And this is also very important that as a dermocosmetical brand, we do have our job to play in the responsible approach. And last year, when we have done the repack, we have taken this opportunity to remove all the outer boxes and so on. And this being said, it was the opportunity for us to save 8 tons of cardboard. So really a big step for us in this responsible approach. So you see, when you are advising and you are purchasing a Topicrem product, behind every one of it, you have all these 7 pillars really proposing this top of the expertise of Topicrem. And this is really, really important. Okay? So that was just to give you some key information about our brand and about our group. But now let's dive into the deep and into the products, and I would like to start with our first range. I will have the pleasure to speak about hyperpigmentation, dark spots, and to do so, our range to treat these dark spots is Mela. I'm sure that everyone here knows everything about this range, but I think it is important to give you more information. Of course, some generalities. First of all, you know the numbers better than I do, but you know that hyperpigmentation is a universal concern. Everyone all around the world might have dark spots, as 1 person out of 2 is affected with dark spots, and unfortunately for us, mainly women are. But regarding these dark spots, actually we have also to speak about the different types of dark spots. Because you have 3 different categories, and depending on the categories, the approach will be a little bit different because the causes are different. So the first type of hyperpigmentation will be the lentigo, which will much more affect the fair phototypes. And these lentigos are coming actually after an overexposure to the sun, okay, but also with the age. They are very easily recognizable because they are small dark spots, most usually localized on the face, décolleté, back of the hand. Second category, you will have the post-inflammatory hyperpigmentation, which in this case will affect much more the darker phototypes. This specific hyperpigmentation will occur after acne, scar, but sometimes also after atopic dermatitis. And in this specific case, yes, it is really important to take care about, at the same time, the inflammation which is the cause, but also to treat the hyperpigmentation. Final category, you are going to have the melasma, also known as pregnancy mask, because it can occur during a variation of hormones. Of course, it is not only during the pregnancy that it could happen, but during hormonal changes, it could be menopause, it could be hormonal treatment that could lead to this kind of melasma, easily recognizable because it is a very large and extended dark spot, mainly located on the forehead, the cheeks, even on the chin, and sometimes all around the face. Which is also very important to know, and I'm sure you know that, but when you have melasma, you have an hyperpigmentation, which is also related to an hypervascularization. And during this time, we have known that through some scientific studies, that when you have a melasma, it is also important to take care of this hypervascularization to avoid the relapse of the melasma. So this is really important to have that in mind. You will see why just after. So, just a quick reminder about the melanogenesis. I know that you know how it is working, but it is important for you to understand how in Topicrem we are going to take in charge the melanogenesis process. The idea is not to stop it, the idea is to regulate it. It is really important because if you stop, if you block the natural process, your skin is no longer protected. So we need to regulate, okay? So as you can see, the melanogenesis, if we want to be very basic, will be divided in 4 steps. First one, stimulation of the melanocyte. And this stimulation can come from different factors. It could be external factors, such as UV, blue light, pollution, but it could be internal factors, such as inflammation or hormones. Once your melanocyte has been stimulated, it's going to start to produce melanin. And to do so, your melanocyte will need 2 things: an enzyme, the tyrosinase, and an amino acid, the tyrosine, to lead to the production of this melanin. Once you have produced your melanin, actually your melanin is going to be transferred to the keratinocytes through the melanosomes, and then you are going to have this transfer, and the melanin will be released inside the keratinocyte. And thanks to the cellular renewal, the keratinocyte, which is full of melanin, is going up and up and up, and then you are going to have an accumulation of this melanin at the surface. So very simple, but actually quite complicated to treat, because as you have imagined and you have understood, if you want to have something which is a long-lasting efficiency on dark spot, you have to treat the 4 steps with one product. If you are only working at one level, you are not going to have a successful results. So this is the reason why in Topicrem we have developed actually the Mela range, which is going to take care of all the different kind of dark spots on all phototypes, and of course taking care of the 4 different steps of melanogenesis. As you can see here, we have a range really whole and complete with hygiene product, body product, and face products. And all these different references are having something in common. They do have a patented Mela complex inside, which is really important because it's the key of our success. Thanks to the algae extract and the niacinamide, also known as vitamin B3 or vitamin PP, this complex, which is patented, will help us to treat the first 3 steps of melanogenesis. Thanks to these 2 active ingredients, we are able to treat the stimulation of melanocyte, the production of the melanin, and the transfer of the melanin to keratinocytes. What about the step 4? You are going to see that, of course, in every product, we are going to have another ingredient that will take this specific step in charge. But thanks to this patented Mela complex, we are able to provide the whole and global action on melanogenesis. So if you want to look closer, so let's start with the hygiene product with the unifying exfoliating bar. So it's an exfoliating product, so it's not to be used every day. It's once a week, twice a week maximum, and it can be used on the face and the body. Here, this is a perfect example of the fourth step, because we are really working on correcting by eliminating this accumulation of dead cells full in melanin. So it's perfect to start your routine to treat the dark spots in order to prepare your skin in order to receive the products you will apply just after. But once again, be gentle. Once, twice a week, stop. No more. Then we do have our body lotion. I know you know this product because this is the number one. Number one in France, number one in Nigeria, number one everywhere. This is really the best-selling product in Topicrem. And of course, it is the number one. It has everything. It's correcting, it's unifying, it's regulating, it's preventing, and icing on the cake, it's protecting from the UV. You have an SPF inside. So clearly, if you must have one body product, this is this one. And that's not all. You will have an anti-relapse efficacy. Even if you stop applying the product still works on the skin. Yes, here you will see. So some figures to first, just to show you how it is going to work. After 2 months of use, here you have the key figures on the number, the size, and of course the contrast of the dark spots. But what I wanted to show you is this after the anti-relapse efficacy. Here, you stop using the product. What we can see is even after stopping the product, it's still going to work. Why? Because thanks to our products and thanks to our Mela complex, we have educated our skin to regulate its own production. So even if you are stopping the product, the dark spots are not coming back. Of course, avoid over-sun exposure, indeed. But as you can see, really wonderful results. And if you want to have a look at some pictures, here you have some, so on every phototypes, fair and dark phototypes, and different types of dark spots. And you can see that after 56 days, you have astonishing results. So that was for the body milk. So now we have understood why it is the number one selling product. But don't forget that in the Mela range, we also have face products. Because we know that the face is actually the first thing in our body exposed to the sun and so affected with dark spots. So for us, we have an entire face routine with a serum, a day cream, a night cream, and a mask. All of them will also include this Mela complex to provide you correction, prevention, regulation, and unifying action. But each product will have, of course, some differentiation. First of all, the serum. Of course, the most concentrated product, which is going to go deep down into our skin cells to really treat our issue, in this case, our dark spots. What is really different with this product is you can apply it on the face, of course, on the neck, on the décolleté, but it can also be applied on eye contour for people with hyperpigmented dark circles, for example. Okay? And if you want to go further, you do remember when I spoke about the melasma and the correlation, the relationship between hyperpigmentation and hypervascularization. Actually, we are taking that into account in this specific product with a specific ingredient that will help us to act on this hypervascularization and give us these wonderful results on the MASI score, because we have a minus 60% on the MASI score in 56 days. So really something encouraging for the women with melasma. And for people who don't have melasma but lentigos or post-inflammatory hyperpigmentation, you start to have the first visible results in only 7 days. Once again, it's the first visible results. Of course, we do not expect to remove and make the dark spots be vanished in a week. Unfortunately, I'm not Harry Potter, so far it's not possible. However, after a week of use, you see your first visible results. It's really encouraging to, of course, continue and follow up the treatment. If the serum is really nice, of course, alone it's good, but it's always better when you apply a day cream on the top. And in this specific case, you must have the day cream in the Mela range, as this specific day cream will combine the efficacy of the Mela range, so treating the dark spots, plus offering an SPF 50 plus. So we know that the UV are the first responsible for dark spots, so you are going to have this first protection. Associate with another protection, the blue light, which is another trigger for dark spots. So here we are providing this double protection during all the day against the appearance or reappearance of dark spots. What is also very important with this product is you can apply it so in the morning after your serum. It doesn't have any white marks after the application. For the women, you can apply your makeup on the top of it, and it is also okay for the eye contour to cover and to protect this very fragile and delicate area. Of course, once we have done that, we have the perfect morning routine. But what are we going to do at night? We remove everything, we cleanse our face, very important, with gentle cleansers, and then we reapply our serum, and you have your night cream, which is also including actually this Mela complex, once again, to target our dark spots. But in this specific case, we want to boost the stage 4 of melanogenesis by having a keratolytic action to provide a gentle peeling effect. And so, since the first night of use, you are going to have a more even complexion, you are going to smooth and to refine the skin texture, and night after night, your dark spots are going to be reduced gradually. And if you want to boost, of course, your routine, you also have the mask, which is actually a combination of the mask and the scrub. You can do twice in one product, okay? So you apply it once again, it's a scrub, so it's not a cream, so it's once or twice a week on the damp skin. And you are going to leave your scrub on the face. Why? Because you are going to have a chemical peeling inside. So you need to have sometimes, of course, for the chemical peeling to work on. And after the 10 minutes, you just have to gently scrub all over the face and to rinse. In 10 minutes, you are going to have a radiant face, a baby skin, and of course, you are taking care of your dark spots by having this complementary action to boost your current daily routine. And so just to show you, I have pictures to share with you. So first with the serum, these are the results that we can expect after 2 months of use. So here we do have lentigo, hyperpigmentary, post-inflammatory hyperpigmentation, and here we did have melasma. So as you can see, the melasma has been significantly reduced, but also I would like to say that not only the melasma, but look at the skin quality, which has been significantly improved after the use of our products. So this is for the serum, and this is for the day cream. Once again, the day cream alone. If you combine with the serum, the results will be even better, of course. Okay? Is everything good for you? Yes. Good. So, 4 key points to remember. Very simple, as you have understood that Mela is dedicated to everyone. Whatever is your dark spots, whatever is your phototype, Mela can be used. We have a Mela complex which has been tested on everybody. And we have a routine which is really from the head to toe, I can say, because we have a whole routine from the face and the body. So this is really important to have the same efficacy from the head to the toe. And with the very good sensoriality, of course, this is important, but most of that, of course, with security, yeah. And so we've adapted for the sensitive skin, of course. And once again, it is really important that we have this notoriety and this knowledge with the first product of the range, which is our body milk. Everything is okay? So we have the Q&A after the session, or we can do it between? After? Okay, after. Perfect. So, leave the world of the dark spots, as you like. No? Okay. And just let's enter into the acneic world. So for combination oily and acneic prone skin. And in Topicrem we have a dedicated range for that, which is AC Control, really the expert in anti-imperfection or the imperfection to really have a perfect skin. So just to tell you some generalities, you know that acne is really the most common pathology all around the world. Actually, almost 9% worldwide has been affected with the pathology, with, of course, a strong, we have a lot of people, like young people, because 90% of the teenagers are concerned with the acne, but don't forget about the adults, and especially, once again, the women, because until 54% of them can be affected with acne. So this is a pathology that can affect actually everyone. And this mechanism of the pathology is quite simple. Just like for MELA, I would say we are going to have 4 key steps in the acne. The first is starting with the same basis, it's an hyperseborrhea. I mean, you are not going to have acne if you have a dry skin. It's always on an oily skin. So you have the hyperseborrhea that will lead then to the hyperkeratinization. And then you have a first step, which is really important, which is the dysbiosis of the acne microbiome. Usually we were speaking about the colonization of the C. acnes, but recently some clinical studies have shown that it's not the C. acnes which is the problem, which is one specific strain of the C. acnes, which is proliferating and multiplying, and that will lead to this inflammation that will make appear the papule and the pustules. So it is really important to take, once again, to have all these different steps in mind, because as in Topicrem we know the pathology of the skin, we are also going to take care of these 4 different steps in our topical approach. So, as you have understood, we have 2 types of acne. First, which is called the retentional acne, which is quite basic. It's stage 1 and stage 2. So it is called with closed comedones or open comedones. But when you have the dysbiosis of acne coming in, then you enter into the inflammatory acne world, if I could say, and then in this case you are going to have the papules, the pustules, and for the more severe cases, the nodules. So obviously it is important also to mention that in the case of the nodules, and we are going to see that later, topical products such as dermocosmetic products are not going to be a solution to treat. We will accompany oral treatment to restore the skin comfort. However, we are not able to treat an acne as severe as this one. Okay? But we are completely able to treat this kind of acne. So, just like as you can see here, you know the global evaluation of acne. So, to be quite specific, Topicrem as dermocosmetic brand, will be able to accompany you in the treatment of the acne from grade 1 to grade 3, and to accompany you in oral treatment, so isotretinoin, to restore the skin comfort from grade 3 and grade 5. Okay? And to do so, we have an entire range dedicated to the acne people with hygiene products, daily skincare products, and we also have specific care and even food supplements with an inside approach with some capsules. And such as in Mela, as you can imagine, we do have, of course, a red thread active ingredient that will be in every product of the range, and this one is the zinc gluconate. The zinc gluconate, which is really key today, as you might understood that the zinc has 3 key properties. It's going to help us to seborregulate, to have a seborregulating action. So very key because this is the base of acne. Second, we are going to soothe the skin to, once again, to take care about its inflammation and to help the healing process. And 3, we are going to have a soothing action, a purifying action, to help to limit the proliferation of bacteria, and in this case, the CRPs. So thanks to this one and only active ingredient, we are able to reduce the shine, but also the appearance of imperfection. Of course, to reassure you, we do not have only zinc gluconate, we have a whole bunch of formula inside, but the key ingredient will remain this one. So if we start with our hygiene products, we can start with our 2 iconic products, micellar water and purifying gel. So if we have to make some distinction between them 2, actually the micellar water will be here to remove the makeup, while the cleansing gel is just here to cleanse the face. But both will already contain the zinc gluconate in order to purify the skin, tighten the pores, and so prepare your skin to receive your beauty routine. Both products can be used on the face and eyes, and for the gel, also on the body, for the people having acne on the body. And they can be applied on a daily basis, morning and evening. So very important to have the good hygiene product in acne, with no alcohol, with no much surfactant, to not aggress the skin, which could lead to an overproduction of sebum. So of course this is not the case here. Then, if you want to have like a complementary approach in your acne program, you can use once a week, twice a week, the mask, which is a purifying mask to help you absorb the excess of sebum, just like an absorbing paper. So it will leave your skin really supple and soft, but completely mattified. And once again, very important, moisturized. Okay, because most of the time the purifying mask can be a little bit heavy, and then your skin after is tightening, but inside we do have some glycerin, so to maintain the moisture, which is really, really key in this case. So once to twice a week, you apply all around the face during 10 minutes, and then you just have to rinse. And to go further, you might have also this inside approach with food supplements, so the capsules, which are also containing some zinc inside, but vitamin B, vitamin B2, B3, B8, some nettle and burdock, in order to really take care of anti-inflammatory, antioxidant, and to regulate the excess of sebum from the inside. So very, very easy to do so, thanks to 2 capsules per day during lunchtime. It could be whenever you want, morning, noon, or dinner. And you can have that during 3 months of treatment, and you can start it even at 12 years old, so also for the teenagers. But now if you want to speak about the treatment themselves, you have actually 4 of them. The mattifying care, which is, as the name suggested, a mattifying product, so here only for combination and oily skin. No blemishes involved for this product, so it is just to remove these shines that might appear at the surface of the skin and to absorb them. It will also tighten the pores and provide an anti-pollution shield, because we know that pollution is also one of the triggers from the sebum production. 10 hours of mattifying action, so 2 hours above the market average, which is really important, and as you can imagine, of course, makeup, an excellent makeup base. Now, if you have patients with imperfections, so from grade 1 to grade 3, you can recommend balancing anti-blemish care that will at the same time prevent the imperfection, correct the imperfection, and balance the acne microbiome, and so avoid the relapse of the acne. It will also have an anti-marks action, because we know that when we have imperfections, it's not only the imperfections themselves that we are fearing, but also the potential residual marks that they can leave. And so we want to avoid that. So thanks to this product, we are going to take that in charge. You apply it morning and evening all over the face. And if you have a rush, like a crisis of acne, and you want to have a very, very quick product and very fast efficacy, you might apply the intensive serum, which is going to be your SOS product, because it will deliver you and offer you results in 2 nights of use. 2 nights, so very, very quick. In 2 days, you are going to reduce by 28% your imperfection, so very, very quickly. Of course, you can continue after these 2 days. Of course, I encourage you to do so, to go a little bit longer. But thanks to this product, you are going to have a very taking charge of the pathology, and of course to restore the confidence and the positivity to the patient with this acne rash. So on a daily basis, on the entire face, and you can use it really as long as you need it. So, as you have understood, these 2 products for grade 1 to grade 3, and we have the compensating moisturizing cream in the case of the most severe acne, grade 4 and grade 5, when we have an isotretinoin treatment. We know that these specific treatments can lead to a dryness of the skin, okay? And so we must compensate this dryness. So the compensating moisturizing cream is here to do so, to restore the skin comfort in only 3 days, with a good amount of lipids, a good amount of hydration, and to avoid the appearance of tightening and tingling and redness, but also to work on the residual marks and make them disappear. So you apply it in the morning and the evening, the time that you have your isotretinoin treatment, and even after, because we know that the side effects will of course be present even after stopping the isotretinoin treatment. And so just to finish with this AC control, just like formula, I think some pictures could be interesting to see the before and after. So with the balancing, I'm just going to put it there, it will be easier for you. So for the balancing anti-blemish care, as you can see, we have astonishing results. So if we focus on the red square area, we can see that the imperfections, the numbers of them have been reduced. The skin quality also is better, and the inflammation is also really gone. So this is for the first model. We have another one with a grade 1 or 2 of acne, and as you can see, the imperfections are going with no marks on the skin, and so in 28 days, clearly we have wonderful results. So this is for the balancing care, and what about the intensive serum? So here we have our first model, and if you want to look a little bit closer to her imperfection, so we can see that after the 2 days, so as I told you, we have first visible improvement in the skin, in the imperfection, in the inflammation. And after 28 days, I mean, it's really, really like a new skin coming in, because almost no more imperfection without the marks are going to be, of course, removed a few days after. And we have another model here. So with some acne much more located on the jawline, with some kind of a big imperfection, especially on the bottom of the jaw. And if you look at the end of the treatment after 28 days, we have a significant improvement regarding the imperfection, but once again, look at the global skin quality, and as you can see, the sebum regulation is well working also here. The skin is less shiny. So once again, it's not only a treatment, like local treatment on imperfections, but a global approach on acne, on the 4 steps of acne. So now you have understood that with AC control, you have everything to succeed, of course, to treat all types of lesions, inflammatory, retentional, of course, if it is a teenager, if it is an adult. And what is really important is the routine that I've been introducing to you are non-photosensitizing. So they can be applied morning and evening, and you have one product for everything. So it's really easy for everyone. And what is also important is that we have developed fragrances and textures adapted to teenagers and adults to maximize the compliance, because in the case of acne, this is really, really key to have this compliance obtained. Okay? Of course.
So thank you very much, Celine. Another round of applause for Celine, please. Thank you very much. So Celine has taken us through the Mela group of the products. Can we get the last one for the question Q&A? So, yeah, so just short questions. If you have any questions, please let me know. And then we've also gone through the AC products as well for acne. So if you have any questions about the range that she has presented so far, we'd like to have your questions. But in the meantime, Ruth, it's Ruth anyway there. Can we have the tea break? In between. Okay, so as questions are coming, then actually, great. So if the tea break is ready, then please let's just make our way out and begin to start the tea break. So she's spoken about the Mela group for hyperpigmentation and those spots, and then the acne group of products. I found it interesting that for the Mela, for the scrub, she emphasized that you shouldn't do the scrub every day. The scrub should be once or twice a week. Because I know some people scrub their face every day with scrubs when it's not butter that you are trying to clean, So that can be harmful to the skin, and I think she emphasized that. So great stuff. All right, so any questions so far? Any questions? Okay, great. So let me bring the mic to you. So just introduce yourself and then just let us have the question. Celine, I think that would be great.
Okay, just a very short, quick question. Dr. Mrs. Jennifer Owezoke. The trials you had on the Mela group that gave such results, I would just like to know whether they were in blacks or in which group. Thank you.
The skin color, you mean?
Yes.
From skin type, from the result I have shown you, it was from prototype 5 and 6 only. I have other results with prototype 2, 3, and 4, but I have chosen to show you only the results from prototype 5, 4, and 5 and 6, sorry.
Okay, great. Okay, thank you.
Hi, good afternoon, welcome. My name is Dr. Jones. I wanted to ask about the efficacy and testing for pregnant women. I'll say for
Regarding AC control or Mela? Both.
that they have problems with acne
And hyperpigmentation. Of course. So thank you for the question. So very good question. So regarding pregnant and breastfeeding women, actually regarding the Mela range and as AC control, we cannot perform tests and clinical studies on pregnant women and breastfeeding women. This is not authorized. However, the test that we have performed with our toxicologists, with whom we're actually developing our products, are saying that the use of the Mela products and the AC control is okay, but they are always advising to ask to a dermatologist or a GP if necessary and if we have doubt. However, there is no contraindication so far. If you have sometimes we can have a rush of acne after because in the formula we have a very global approach. So we have 2% of succinic acid which is a new active ingredient replacing the salicylic acid commonly used. And why have we chosen this specific ingredient? First, because it has better tolerance with sensitive skin, and second, because it has better efficacy with imperfection. Just to give you an example, succinic acid will have more than 200% more efficacy versus salicylic acid on imperfection. So we are going, this is why it's a crisis and emergency product, because in a very short term, you are going to have quicker results. So this is why I'm naming it like that. Absolutely, it's possible to have a long-term use. No, it will be not anti-crisis, but if the crisis sometimes can last longer. Yes, exactly. This is why we have done the test during 28 days, to be sure that it was okay for long-term use. You're welcome.
So one question here.
Of course.
Good afternoon, everybody. My name is Ibrahim Yusuf.
Nice to meet you.
I write for the Nation the brand reporter. A very wonderful exposition you have actually had here. I have two quick questions in relation to the job I want to package. The first question is out there, your brand is Topicrem. It has already gained a lot of traction in the public space. But as you and I know, we have people who they want to counterfeit the products. What are the measures in place to stop people from counterfeiting? Because some persons they see by top cream that could be counterfeited. So what measures does the company have in place to stem that that issue first? Secondly, you find that if you look around, I'm not trying to. If you look around, majority of our women this is the topics. Some of the ideas you have espoused here, I think, to my mind, they work for Caucasian and all of that. What the products you are bringing to us and to our market here, how available will be to our skin? Because you see find a lot of women who have dark spots. If you look around, take somebody around, average of maybe 10 women, you see 6 having dark spots and all of that. Maybe you wish to tell us what you have to address that. Thank you.
Thank you. So for the first question, I will ask Joseph answer that.
Hello, good evening, everyone. First of all, I'm so happy that I see a lot of crowd here. I'm very, very appreciative of to know what's happening in the country because of the first casting. And from that, everybody to commit. There should be a lot of commitment to other people, so I appreciate that. So to answer your question, as a Nigerian, I take adverse measure to make sure the Topicrem is registered with NAFTA. That's one. The second one is that I make sure that Topicrem is not selling in the open market. It's restricted and monitored very, very well. I'm inside the market and I know the Nigerian market very well. Before I go over to Topicrem, I'm exclusive distributor of oil for years and global import of P&G products. And also, I introduced Neutrogena products here from Michigan for so many years and make Neutrogena popular all over, and I see it constantly. I am the first company to import 5 containers of Neutrogena from the United States. No African country imports Neutrogena. My order operation by the United States and they see that Nigerians is doing well with Neutrogena. So it was protected up to today. You hardly see Neutrogena fake. So in that, I applied it in Topicrem. You cannot compare Topicrem with Neutrogena. Topicrem is a dermatology product, strictly dermatology product. And I make sure that it's not sold in open market. It's only from my warehouse, from my own stores, to every dermatology or pharmacy stores in this country. Order it, I will deliver it to you. That is why I don't have popular, availability in everywhere. Where it's supposed to be available, you get it there. You can't just go to common stores and get it. Okay? And make sure that profit is being added to Topicrem brand, whoever is using or selling Topicrem, both in pharmacies or dermatology products and dermatology clinics. And also maintain one unit price. And the reason why I maintain one unit price, so that tomorrow, if anybody says it got the cheaper than Topicrem, I'll move to that person immediately. How did you get the Topicrem? That is a very strict way. I tell you how you get to Topicrem. And then I was strictly to be fighting parallel import. Because if I start having two prices, I need the product. So today, if you say, Topicrem, I'm selling me that for 5,000, and someone says 40,000, it's a problem, and I'm known everywhere. Information will go everywhere immediately. Job particles or Topicrem is known everywhere in the country. Okay, so that answers your question about control about freight. Thank you very much.
Thank you, Joseph. And regarding the second question, if I have understood it well, so really to reassure you regarding the different phototypes that we are doing and performing our clinical studies, and yes, to reassure you that our products are also dedicated to even the darker phototypes. Actually, as I showed in the pictures previously, we are always conducting studies with phototype number 2 to phototype number 6, so including the fairest and the darkest phototype, to be sure that our products will be efficient and we have results whatever your phototype is. So even here, even there in Africa, Asia, or where else, our products will be dedicated and adapted to everyone. So you can completely be reassured on that. And to give you some example, we are performing our clinical studies much more in Mauritius Island, where actually you have the more different phototypes represented there. So this is why we have chosen specifically this area. So I hope it's reassuring you. Any other questions?
So thank you very much. I mean, so she had mentioned 3,000 sensitive skin types were tested, 12,000 healthcare professionals were recruited, and Topicrem is a feel-good dermatology brand, and of course, it's a sustainable brand. So round of applause once again for Topicrem. And of course, I really like Mr. Ude's confidence. Like, it was not, the product is not just going to be lying around anyhow, they do more. It is well controlled, so very well done, sir. Thank you so much. Round of applause for him, please. So, I'm sorry, because tea break is not ready, and some of the guests are already gone out to try and get tea break, but it's not ready yet. So I think we would hang on with the questions for now. I think, sir, you can continue. Yes, and then after it all, we'll have more questions. So please proceed with the next set of products.
Okay. Thank you very much. And so before the tea break will be ready, let's continue a little bit our deep dive into Topicrem universe and products. And so I'm very pleased to introduce to you our specific universe of irritation and fragile skin through the Sika range. So it's a very short range because we have two references for the moment. But the idea here is really to give you a solution to provide a quick healing process. And to do so, actually, we have two different products. We have a cream and we have a cream. Actually, why two products? Because depending on where is the wound and if it is an epidermal healing or a dermal healing that you are looking for, you are going to have a different product. So if we speak about the cream, the repairing soothing cream, it will be for, I would say, on everyday basis for every burning, irritation, even tattoos. It could be cracks, chaps, it could be mosquito bites, chickenpox, it could be post-aesthetic procedures, it could be almost everything. So really, as soon as your skin is irritated and getting weakened, you can use this cream in order to repair your skin in 3 days, but also to soothe it, to avoid the tingling, the scratching, and so on, as you are going to reduce your skin reactivity by 53% when you apply the cream, so immediately after the application. And we are even going further by reducing the same skin reactivity by 93% in 15 minutes. So, just to give you an example, if you have been bitten by a mosquito and you want to scratch, when you apply your cream immediately after, you are reducing by half this feeling of scratching, and after 15 minutes, you don't feel anymore, so everything is good. So this cream can be really applied everywhere, on the face, on the body, on the intimate area as well. So if you have a baby with diaper rash, it can also be used for this specific use. So what I told you, it is really the must-have in the bathroom to really take care of every pains and aches that we can have in the family. But really, once again, for epidermal lesions. When we speak about dermal lesions, such as stretch marks or scars, now we need something different because we must go deeper into the skin, and for that, the oil texture is the best. So this is why we have developed the concentrated oil, actually, that will help you to massage your skin, to reduce the appearance of stretch marks, but also to reduce the visibility of the scar. The idea of this product is not to make the stretch marks or the scar disappear. It's not possible once again. But once again, we are going to work on the visibility and the color of the stretch marks and the scars in order to make them, of course, less visible on the skin, obviously. So, of course, if we speak about stretch marks, you can imagine that this product, to join your question, is of course okay for pregnant women and breastfeeding women. And you can start it from the first trimester of pregnancy, when most of the time you might have some products that you have to wait from the second trimester. So you can use it during whole pregnancy and even after, of course, to avoid the possibility of appearance of these stretch marks. And for the scars, wait for the remodeling phase to start, of course, the application of the product. And if you want to look closer at some results, so if we speak about the repairing cream, it is exactly the numbers and the figures I gave you about the skin reactivity. As I told you, you have an immediate response when you apply the product, so immediately your skin will be soothed, and also after 3 days it will be repaired. As you can see here, we are going to accelerate the epidermal repair versus a skin which is not treated. So we are accelerating it. As you can see, the growth path is bigger and longer, but the adhesion to the dermis is also better. So it means that we are going to have a better healing process than if we compare with no treatment here. So really something that we must add in our healing routine. And speaking about diaper rash, I would also like to share with you some pictures, because we have performed an observational clinical study regarding this specific concern. And as you can see, the average repairing time in this specific concern is 3.1 days, so quite quickly. And as you can see on the different picture here, so at 0 we have a very severe diaper rash, but after 3 days we can see the erythema has been significantly reduced, and after a week the diaper rash is completely gone. And even if you have a very severe, you see after 10 days, oh, we have some echo here, your diaper rash is completely vanished. So it's really reassuring also for the parents to be sure that when you have these products, your baby is not going to suffer any longer. And regarding the oil, it is important also to see the results on scars and stretch marks. So here you have on scars on the hand and on the eyebrow. So as I told you, the idea is not to make them disappear, which is not possible, but to reduce their visibility and to reduce the thickness, so you can feel it the less as possible. And same for the stretch marks. Once again, as you can see here, they are much thinner and less visible. So this is really clearly a big asset to have this product, these two references in the catalog of Topicrem. And I know this is absolutely not the subject of what I'm saying here, but I have just a small tip also for you regarding the cream. Yes, it is a cream that will help you to heal the skin, to repair the skin and to soothe, but you can also use it in a different way. So I'm really sorry, I know that you are all doctors here, but it is something that maybe you can use too, because I mean, we are all concerned with anti-aging, and actually this soothing cream can also be used as a night anti-aging cream. Once, twice a night, twice a week, you can also use it because it's going to stimulate the healing properties, and when we speak about healing, we speak about collagen. And so, of course, doing so, we are going to have a plumpier skin, and healthier skin, and a smoother skin. So it's just a use on the side. It's not like a daily use of the product, but just on the side, just to tell you that you can also have a different approach with this cream. However, what has to be remembered is with the Cica Plus range, as you can see, we have two products, cream to have an approach on epidermis and oil to have an approach on the dermis. But, of course, we are going to have with both efficacy that has been proven in 3 days in a repairing effect with our cream, and as we have seen with our oil, 56 days on stretch marks and 28 days on scars, and always in the respect of the most sensitive skin and of course of pregnant women in this specific case. And so, still to wait about the tea break, I will finish my presentation with the last range. A little bit of sun, because today it's a little bit rainy. I was quite surprised, I have to say. The rain was following us from Paris to Lagos. So I'm really sorry to bring the rain in Lagos, but I will bring you some joy and sun, I hope, with our new sun protection range, Sun Protect. So this is completely new, and we have seen in the previous presentation how important is the sun block. So here we are, we have for you a new sun range to protect, of course, again, the sun exposure. And we have a short range, simple range, with only 3 products: a sun protection, an after sun, and an hygiene product. And yes, the sun protection is available in 2 sizes, one you have in the bathroom and one you have in your purse, because it is important to reapply your sun protection when you are outside. And this sun protection, of course, it is an SPF 50 plus, because it is mandatory, but we wanted to go further to provide you also antioxidants, anti-photoaging, and to boost the mechanism to repair the DNA, and to do so to avoid the appearance of skin cancer. And this specific action is provided by a strong and impactful active ingredient, the Echinacea extract, which will be actually in our sun protection, but also in our after sun product. Because we know that the damage is not only during the sun exposure, but also after the sun exposure, and the free radicals will continue their work, so we must stop them. So this Echinacea extract, antioxidant, anti-photoaging, boosting the repairing effect of the DNA, actually will be in the sun protection and the after sun. And so, if you want to go a little closer to this product, so the moisturizing sun milk will provide with SPF 50 plus, of course, with this anti-photoaging approach, antioxidant action, but that's not only that. This sun protection will provide you no white marks on the skin and no yellow stains on the clothes. This is also very important to not have these kind of marks on the clothes when we apply our sun protection. It does not sting the eyes. It is resistant to sand and to water, which is really important. And remember, very important, protective moisturization by Topicrem. It will provide you 24 hours hydration. You can apply it, of course, every day, in the morning, and to reapply it when it's necessary, on the face and on the body, on children from 3 years old and adults. after that, it is really important also to take care of our skin after going back home and after the shower. So we will come back after the shower. After the shower, after removing perspiration, UV filters and so on, it is important to reapply the good product to ensure moisturization but also protection. So after a sun exposure, you have this after sun fresh gel, which is provide you hydration, 48 hours hydration, thanks to aloe vera, shea butter, betaine, and so on. But also, thanks to the echinacea extract, you are going to have this antioxidant, anti-photoaging action to protect your skin even after your exposure. So you are continuing this protection action to continue to, of course, having this protection against all the free radicals that might be fighting your cells and attacking your cells. Same as for the moisturizing sun milk, this specific product can be applied on the face, on the body, on children from 3 years old, and adults. And of course, in between, shower is important to remove these residues of UV filters, sand, salt, chlorine if you work in the swimming pool, for example, and perspiration and so on. So this is why we have this remoisturizing shower, which is going to do so to help you to remove gently all these residues, but also to take care of your skin and to protect it, but still providing 8 hours of hydration. And this product can really be started from the baby age, from birth, on the face, on the body, and for the babies, on hairs too, it's okay. There is absolutely no contraindication for that. I forgot to mention, I think it is important, as you can see here, we have a small logo, the ocean tested. Remember that we have committed in this responsible approach. Of course, we know that sunblock can have an impact on the marine biodiversity. So this is the reason why we have performed a test on ocean, on algae, corals, and so on, to be sure first that our formula is biodegradable, and second, that to be sure that we are going to have a limited impact on marine biodiversity. And we really wanted to go further by having packaging. We are going to have recycled plastic, and with less use of plastic to reduce our use in a plastic in the packaging. So one step ahead, once again, in this responsible approach. And we also wanted to go even further because we have chosen a specific partnership when we have launched our Sun Protect, which is Project Rescue Ocean. So it is a specific association which is actually leading to help population to understand how we must collect, recycle plastic, how they are going to remove plastic from the ocean and from the beaches. So the idea is really to give them some money. So this is why we have this 1% for the planet. So 1% of the total turnover of Sun products will go to this specific association to help them in their project. So once again, this responsible approach is going a little bit ahead and far away. So just to show you a small video, I hope it's going to work. So in Topicrem, it is important to have really simple and authenticity. I would like to introduce to you my colleague, Elodie. She is a French trainer. Because in Topicrem, we do not use models, we use only employees and consumers of Topicrem in our visuals. So this is actually my real colleague, Elodie. Oh, sorry. And the second time, Elodie. So just to finish this presentation, and after I think you have deserved your tea break, I think it is now ready. So just the 4 key points to remember about Sun Protect. I think you have understood already everything. But with Sun Protect, you have a simple, easy range for the whole family from 3 years old, with an antioxidant ingredient, with the Echinacea extract to provide you antioxidant and anti-photoaging approach, with of course all the sensoriality of Topicrem through this positive energy of addictive fragrance and pleasant textures, and of course a step further with this commitment through of course packaging which are eco-designed and with limitation on the impact on the marine biodiversity. So thank you so much for your attention. Thank you for your participation. And if you have questions, of course, I'm all ears.
Thank you very much, Celine. Round of applause for her once again. Okay, so we are going to have a photo op. You want to do the photo op now or the questions first? Okay, let's do the questions first. Alright, so great. Thank you very much. So the set of products that she just presented with is Sika, that's how to pronounce it right. So Sika Plus, and then of course the sun protection range. And with the Sika Plus, of course, she talked about how if there are mosquito bites, you know, the Sika Plus can actually help to soothe that pruritus and the itchiness from the mosquito bites. The mosquitoes in my area, it's really anointed oil. Anointed oil from Jerusalem. I used to work, don't ask me where my area is. The mosquitoes there are different. But yeah, so I think that's something that's very useful and valuable, especially for young children. And of course, as a pediatrician, because yes, I'm a pediatrician, she talked about diaper rash and how quickly it can heal diaper rash in 3.1 days on the average. So I thought that was really good. And I'm assuming that this is like diaper rash, not fungal diaper rash, it's diaper rash from the regular irritation, you know, maybe the diaper isn't absorbing very well. So I thought that was really nice. Then, for the sun protection range, please be getting your questions ready if you have any questions. So for the sun protection range, I thought the idea that, so UV protection, so part of the issues that some of the sun protection creams that we have, some sunscreens that we have, is that they leave that white cast, you know, so the face thing. And I'm sure that we don't have a white cast here, because sometimes when people use sunscreen, they walk around looking like willy willy, or somebody that they're about to sacrifice. Because I mean, I've used, you know, those products before, and of course, I got to work and they're like, Dr. Rena, are you okay? Because I was looking pale as a ghost. But so hopefully white cast is not something that we'll have to deal with here. I thought it was very interesting that sunblock, so she mentioned that sunblock does not affect the marine biodiversity. I think I'd like you to explain to me how, you know, other sunblocks, how and why they affect, you know, marine biodiversity. I think that's my question before I proceed.
I think it's a good question, and thank you for asking it. Actually, there are several clinical studies that are showing that the sun filters will affect actually the marine biodiversity, the corals and the algae, and you will have actually the filters will go on the corals and they will asphyxiate them, and all the corals will become white, and so they are going to die. And we know that the corals are also the first key element to be nutrition and nutriment for other fishes and algae and so on. So if we have an impact on that, we have an impact on the entire marine biodiversity. So this is the reason why we have decided to perform this clinical study, to be sure that we are not going to have this kind of impact and to respect at the maximum as we could this very fragile ecosystem.
Thank you very much. So this is if a person uses those other types of sunblock and then goes into the water, it can actually affect. And of course, you know, use a lot of sunblock on the screen. But I mean, this is assuming that the economy has not already killed the marine biodiversity, or that we've not already eaten all the whole marine biodiversity in this area in our waters. So yeah, so that being said, really great. And of course, you mentioned that there is less use of plastics in the packaging. And of course, I think responsible and sustainable methods of marketing and producing are very important when it comes to these things, because there are plastics everywhere. Okay, so great stuff. So a round of applause once again for Celine. I think that was So if you have any other questions, I'd be happy to bring the microphone to you to ask your question. Yes.
Sorry, I'm a pharmacist by profession, so that's why my question. I know that I participated in a trial where we tested a product and were advised not to use any other product with it. So I don't know whether your products are very exclusive, like you must use them alone, or when you use them with some other products, is there any chances of interactions that could be adversely affecting the patients?
So if we use Topicrem in other products, you mean? So of course, I cannot answer that with 100% warranty, as we cannot perform clinical studies with Topicrem products and competitions, as you might imagine. However, regarding the way how we formulate our products and as we are respecting the epidermis and the most sensitive skin, normally, if the other product that you are using respect the same charter, it shouldn't have any issue. But regarding the product you are using, maybe the combination could be also having side effects. And regarding that, I can't say that we are protecting you from that. Sorry.
Thank you very much, ma'am, for that question. I think it's really important. I know we don't talk about drug interactions with skin products a lot, even though there's this, possibility, things like photosensitization, things like, drug interactions. So, is there anything that we should be concerned about when it comes to drug interactions or photosensitization with any of our products?
It's a very good question, and this is why actually I mentioned earlier regarding AC control, because usually when you have acne, there are most cases when you have medication and drugs. So this is why we have a specific product tested for these people. Regarding the other products, of course, we haven't performed this kind of test, so I cannot say if it's okay or not, depending on the medication that you are taking. But however, it is always very important take advice to a dermatologist or physician to be sure that we know having interaction between the medication you are having, antibiotics or so on, and your skin problems.
So fantastic, that answers the question really. Okay, so one question. I think we're creating some space, right? That's what's happening. Great.
Okay, my name is Chico, Madam Pharmacist. I would like to ask regarding specific storage conditions. Because some of these creams and ointments, you find out that when you leave them on the shelf, sometimes when the patient gets to use them, they open and they find discoloration. And sometimes they bring it back to you, questioning, asking, saying, this might be expired or it's no longer good. So I would like to know if there are storage conditions and if there are possibilities of color change when open.
So thank you for your question first. So I will start and then after maybe Joseph you will have to add a word of my answer. So first of all, it's really important to say that yes, we have performed tests of storage of the product in very hot temperatures, but also very low temperatures, to be sure that you are not going to have any change in the formula. So this is the first thing. Second, when you have been stored your products in the good area, so of course not very high temperature or too low, but we have tests that show that during 3 years after the product has been produced, it's okay. After the 3 years, even if the product has not been opened, we cannot guarantee the stability after 3 years. However, I think that the products that you are receiving are under these 3 years of age, and so they should be okay. Sometimes you might have evolution in the color, but even if you have evolution in the color, it will not alter the efficacy or the tolerance. That's all. And after regarding the storage in Nigeria, I don't know, so maybe Joseph, you can add a word. But usually they are stored in a mild temperature to avoid any issue. Maybe we have another question?
Yes. Good afternoon.
Good afternoon.
Abiola Miners. I would like to ask about the business side of your products. How affordable are they to the common person?
Okay, so this answer will be this question.
Sorry, sorry, 1 second. Before you take it, let me just quickly get the next question. Question. Oh, okay, so it was the same question that they were going to ask about the pricing.
So, first of all, regarding the affordability of our product, so please be assured that we are trying our best to give you the best affordable products. However, even if the laboratory has affordable price, you have to understand that between us and you have a lot of different people that will interfere, such as customs, such as transportation, and so to do so, actually, we are not controlling this one. And at the end in Nigeria, I don't know regarding the affordability and the prices, so now it will be you, Joseph, on stage.
Yes, I know that this person will come. Okay? Now, yes. See, everybody knows what is happening in this country. Okay? And as a matter of fact, Topicrem is a premium brand and will still remain a premium brand. That is why it's okay? Then, even myself, what's going on in the country, I still need to put the price of affordable. In the sense that we have fluctuation of foreign exchange, dollar rose from 1,000 to 1,500 to 160. Not more than $1, and the price has not gone up. Even today it's 2,000 naira, and I see the price. And declare the cost. Everybody knows what's going on with clearing cost. The government or the customs take clearing cost at the parallel import of dollars. If dollar goes to that today, that's what I'm going to pay the container. We normally pay 7 million to that container. Now it's 20 million, 22 million, 25 million, a 40 container. It's obvious. Even the crayfish in the market, the pure water in the market, everything has gone up. Even the matches, to the extent that you cannot ask your neighbor matches. I only have one. Please, I only have one to use. So that's everyone know what is going on. So please bear with us. I myself am trying as possible as I can to maintain the price even when the dollar goes up. I don't take Topicrem price up as dollar and inflation rate. It's so terrible now. We only pray to God for what is going on in the country. Thank you.
Thank you. Thank you very much, Mr. Alvin. We appreciate your efforts. But my own is that who told Celine about customs? Wow. Who told Celine about customs? Right now. Anyways, so their reputation has preceded them all the way to France. Anyways, so my own question is that she, as I'm going home, I can take this whole shelf away to I have to go through custom. Anyways, thank you guys so much. Yes, so Dr. Jones, very quickly.
Okay, so I don't see in your presentation how to replenish your sunscreen. Is it 2 hours, 4 hours?
Yes, absolutely. As every sunscreen, it has to be reapplied every 2 hours if you have in a long-lasting exposure or repeated exposure. If it's just like you want to have like a daily protection, if you're going to the office, you can have it just once in the morning and after it's okay. But if it's really like if you're on the beach or go to the market or whatsoever, hiking and so on, you have to be inside of this. Yeah, sure. Yes, we do have also a range for baby. No, I didn't present it, but it's still existing. Of course, I just had to focus on some ranges.
Fantastic.
Emollient oil, yes, we still have it in the range TA product. So you have 2 options. You have the TA emollient balm, and you also have the emollient oil. What is the difference is actually the emollient balm, which is more enveloping, a little bit richer to provide, of course, this emollient action on the atopic dermatitis skin. The emollient oil will have the same, but with a small tip. You can apply the oil also on the damp skin, and the oil will transform into milk. So it will be a little bit lighter, so especially during very hot weather, warm weather, when you don't want to have something too thick or too greasy, I would say, but it's not greasy, but too enveloping, and you want to have something lighter, you can switch on the emulsious oil, which will have this milk texture penetrating very quickly, and you can dress up immediately after.
All right, so thank you very much, Celine, once again. Dr. Tropanui, round of applause for Celine once again, please. So the Topicrem discussion, even though we've already started it, but along with Dr. Tropanui, we're going to have a discussion on Topicrem in general, and Josephine Ekimen. Oh, no, okay. So sorry about that. So Dr. Shomanu is giving an expert overview, and she's going to be presenting a very important study that was done with some of the products. So round of applause please for Dr. Shomanu.
Yes, because you have to go for your own tea break, so we're waiting. They want you to go for your tea break.
Welcome to the world of Topicrem, brought to you by Juve Pharmaceutical Limited. For over a century, we've been the secret to glowing healthy skin in Nigeria, with a presence in over 40 countries and trusted by the Nigerian health and skincare market. Approved by NAFDAC, our products are developed in line with stringent pharmaceutical requirements to give you the best care possible. Our range is specially developed to meet pharmaceutical standards, ensuring top-notch care for every member of your family. Let's dive into our fabulous lineup. Starting with our SPF 50+, it shields sensitive skin while delivering ultra moisturization, perfect for both kids and parents. Got rough or very dry skin? UR10 is your go-to solution, transforming your skin from rough to silky smoothness. Say goodbye to dryness with our ultra moisturizing body milk, offering 24-hour hydration and eliminating dry skin. Want to lighten and protect your skin? Melacream is perfect for sensitive skin, preventing dark spots and enhancing your natural glow. For very dry and atopic skin, our DA Emollient Balm delivers intense relief and comfort. Babies deserve the best too. Our Ultra Hydratin Baby Moisturizing Cream and Sika Baby Rash Clearing Cream keep delicate skin soft and irritation-free. Cleanse with ease using AC purifying micellar water, perfect for removing makeup and impurities. Boost your skin from within. AC Control, a powerful food supplement packed with burdock, nettle, vitamins, and zinc. Nourish and fortify your skin with Carete, leaving it smooth and radiant. Reduce flakiness and thickening with UR30, our anti-roughness soothing cream for flawless skin. Soothe your skin with Complex, our gentle and soothing micellar water. Pamper yourself with Dermo Regital, our ultra-nourishing body cream that rejuvenates your skin. Discover the magic of Topicrem, the brand that cares for your skin like no other. For more information, email us at sales@ijapharmaceuticals.com.
Some people actually do label properly. If you have any sensitive skin, you need to read the label properly and be sure what is going on. So the major problem with creams is labeling. What do you put in there? Preservative you put in there. And these are the things that you need to know. That's what I'm saying. But if you have any sensitive skin, one of the things you need to ask people to do is to read the label properly. And not everything that is apologetic is apologetic actually. That is when people write this stuff like this is apologetic. But sometimes if you have issues, we can now look at it and look at it.
Thank you very much, sir. Okay, so I asked that question for a reason. When we put all of these things and they are literally OTC, they're over the counter, they're not being prescribed. The sensitive skin comes when they have used multiple of them at the same time. So you will not be the hypersensitive skin of atopy. You will now have sensitive skin that is technically irritant skin because you have used quite a number of these things. I'm sure the TikTokers and the Instagrammers and the other social medias would bear witness that you have patients who come to you, they have about 10 skincare products because I use my vitamin C for this and my niacinamide for this and my aloe vera for this and my this for this and so I wanted the pharmacist and Dr. Ochodo to actually speak to it because eventually by the time they come to us, they come with a handbag, like hand luggage of cosmeceuticals, products, which individually there isn't any problem, but they all mingle together and then they can say, oh, you don't have very sensitive skin. What we will call sensitive skin, we being the specialists, dermatologists, we're thinking in terms of hypersensitivity, but a lot of people are acquiring, like they are buying sensitive skin. I don't know, do you have any experience of that? Pharmacist?
Yes, we do a lot. We have a lot in the. I think the problem is not with the ones that are the different products, because that's the latest and that's what is being advised, is to layer. So yeah, they are right to layer, especially the tyrosine inhibitors. However, the problem is those inverted organic products, where it's actually steroids they're putting in them, and they think they're using natural products. And of course, the triple creams, those are really the problem we have in the market. That's the problem we have. So it's not the layering. It is right to layer.
That many?
Yeah, sometimes.
That many?
Well, maybe not 10, but yeah, it is.
No.
It is
So
right.
this is a deliberate question, so I need all the experts.
I think as a group, we need to come hard after the triple medications.
Yes.
As a pharmacist, doctor, dermatologist, there are no medication, there are no people those medications, and it's in the market. And again, the antibiotics they put in it is usually nuancing, and that we call sensation. Right? So that's something that we need to start push as a group. That there's no medication for those triple medications, and they are actually causing more problems. And there are a lot of also very potent steroids that will cause bleaching of the skin.
Thank you very much. That I think everybody agrees with. Triple action, no, generally we know that. But I am still coming back to multiple antioxidants, vitamin C, nicotinamide, retinoic acid, arbutin, kojic acid. So the point is, if you listen to Celine's presentation and if you saw her pathophysiology as it were, with respect to pigmentation and how it comes about, yes, we have different spots at which the melanogenesis is happening. We have to think about it vis-a-vis the physiology of the person and where the person is in terms of what's your lifestyle. Are you somebody who works out in the sun? What's your lifestyle? Are you somebody who is hormonal right now? So that's my point. If we go away, we who are so-called experts, people go away with the idea that, well, this one works here, this one works at this point, and then and don't do it. Everybody go inside. We will cause a problem. Because the patients are not going to think about it the way you are thinking about it. You are coming in from the science of what it is. But you have told them, I'm sure the pharmacists will tell you, they will bear me witness that when you tell them this is good, and we say, oh, Abutin is good, niacinamide is good, nicotinamide is good, everything is good, everything is good. Why not? Everything is good. So now we have products that have 7 in 1. There's no way you're not going to access this skin. Even you, when you put it, hey, but you know the average Nigerian thing that if it's not peppery, it's not working. If it's not smarting you, if it's not, you know, then they will tell you, oh, but you know beauty is pain. So, no pain, no gain. That's why you will pull your hair and think that with it. All the hair is falling off at the end of it because beauty is pain. Anyway, I just wanted to bring that up. Let's be careful. Can I go ahead? Thank you. We have spent some time, and honestly speaking, I thought about time. So my job here is very, very simple. I'm supposed to thank everybody who has been here, literally, and just give a little bit of an overview of what we have all heard. So Dr. Adikwe started by talking about cirrhosis, and she went to town and said all the different things that happen with cirrhosis. And then Celine came and gave us a nice gamut of all the products that are available. And I'm sure if we were to do a Q&A here, and I was to ask you that, of the products that she kind of spoke about, which of them really speaks to the cirrhosis that was spoken about before? Anybody at the back? There's a prize if you answer. Why don't you answer? By the way, people in the inner table cannot talk. People in the inner table cannot speak. Anybody? Was there any? So let me remind you. She spoke about the Mela range. Then she spoke about the AC range. Then she spoke about the Sika. And then she also spoke about sunscreen. In the midst of all of them, she said a few things. I'm just wondering. So if you're really paying attention, there's a prize. Yes, ma'am. The Mela moisturizer. Somebody says the Sika. Eh? Men of this. Mela. Okay, anybody? Did she speak about emollient? She said emollient, but she didn't mention one specific word. Technically speaking, that would be the correct answer. There was a little bit of moisturizing and fixing of cirrhosis in everything she spoke about. And that's because emollient is the baseline of anything you're doing in derm. Anything whatsoever. I tell my students, and some of them are here, please raise your hand if you're a student. Wahoo! I tell my students that if I was stuck in an island and they told me, practice your dermatology that you're so passionate about, just practice it inside this island, you have something. I'll bring them down, and I have only 2 products. And they say yes. Please, my students, which 2 products do I want? Sorry? I will ask for a retinoid and I will want a moisturizer. Literally. Retinol will repair everything over time. It's the idea of what the secret is. Any moisturizer, because one way or the other, I will do jumbo, and we'll get there. Now, I brought that because we are passionate and we know that AD is big across the world. AD is big. Mr. Jones has spoken, Topicrem people have spoken, and somebody was asking in the audience that all the studies you are doing, where is the Nigerian one? I just want to put on the table that they have put their money where their mouth is. Put their mouth where their money is, as the case may be. Okay? And I have no much time, but I want to show a little bit, and I'm deliberately not changing anything. This was presented in Gdansk, Poland, last year. The players, as it were, are all in this room, save one person. All the scientists, all the dermatologists, and our research assistants are here. They will take a bow when I'm done. I'm just going to give a quick overview. And if you look at this, so that's the thing, we coined it the Entepidem trial, the efficacy of an emollient moisturizer in restoring transdermal water loss, in pH hydration, in African patients with atopic dermatitis. This was situated in Africa on Africans. So we can say, yes, it was tested. We can even just say Fitzpatrick skin type 5, 6 is not enough in Nigerian patients within the Nigerian climate. look at what I coined my learning objective when I was presenting. These are all the others: Lasso Blue, Lasso and Lasso CMU. The learning objective was to demonstrate the importance of localizing she's back. Okay, we're holding on for Net Pharmacy to speak before, but she just came back. Okay. You wanted to say something? Sorry, please, apologies. We just wanted to, because I had called a few people to try to see about their experience with Topicrem before I get this overview. Yes, thank you very much. Please clap for the MD of Net Pharmacy.
Good afternoon, good evening, everybody. It's very nice to be here. Are there pharmacists in the house? I just want to be sure. Sorry, okay, nice to see everybody. And the dermatologist. I just want to say a few things about Topicrem. It's beautiful how they brought dermatologists and pharmacists. At the end of the day, skincare is going to be a multidisciplinary focus. We can't do it alone. That's why our favorite doctor is there. You almost think she's a pharmacist. I want to first of all appreciate, I call him Oga Job and his team. Can we just give him a round of applause? Thank you, wow. Topicrem is always very supportive of pharmacists. They're always present in our conferences to educate. I'm sure we've all learned a lot today. They invest in knowledge. It's not like other skincare products that will just put them on the shelf and go. These are demo cosmetics. And they are not just there, they have ingredients that address very important skincare issues. Acne is a very, very big market for some people, but then it's a calling. You see how they have to remove the packs, and that saves how many tons? That was my 8. That's my money. So it's not just a business, it's business with heart. They care for the ecosystem also. And we appreciate you, Topicrem. And for the pharmacists in the house, my charge to you is Topicrem is ready to work with you. I have enjoyed a very good relationship with them. They are ready to support you with the knowledge. You can do more with them. You see all the ranges there. It's not just to put them on your shelf. They want you to succeed in your practice also, because skincare is a big thing. We are the first point of call when somebody has acne. The first place they want to go to is the community pharmacy near them. But how can you handle that if you don't have the knowledge or the right products on your shelf? We saw all the amazing statistics that Topicrem is able to achieve just because of the safe ingredients in them. So I will encourage you, after this program, do you have your people around that they can put their details together and you reach out back to them, the team from France? They are welcome. I'll get to know more of the pharmacists also. I know you already work with a lot of the dermatologists, I guess. And it would be nice for the dermatologists for us to know those that are around us, because we can actually work together. We can send them to you what we feel, because we can't do everything. But the beauty of the practice is for us to know where your expertise ends. So there are some things if this needs something higher, so we need to work together. So if there's a way we can have those database of the dermatologists around our practice so that we can work together for the benefit of the patients. So I want to appreciate Topicrem very seriously for this event. And for the pharmacists, let's work with them. And for the dermatologists, let's collaborate for the good health outcomes for our patients. Thank you so much.
Thank you, very well spoken. And yes, these are the faces that I see regularly. I believe we already have a nice collaborator, derm and pharmacist, because I can say without calling anybody's name that there are some pharmacists that are around us in our practice. Yeah, she's not noticing. No, I was just saying, I think we already have a good collaboration, because there are some pharmacists that are close to us, like our Adubo. I'm not calling anybody's name. There are some pharmacists in our Adubo that have actually keyed
into that dermal-pharmaceutical relationship. I call it dermal-pharma as well, and it is helpful. Because every now and then you get one of their staff, not even the owners of the pharmacies, who will call in and tell you, oh, what do you think? Please, you know what, just go to the dermatologist, let's go there. And that's what we want. First, do no harm, like Dr. I think we were saying. So we'll improve. Anyhow, I really do not have much. The learning objective was to demonstrate the importance of localizing clinical trials to specific environments. We're talking One Health, global health, and every time you check global data, global studies, Africa is either not there at all, or it is African American population that is used, and we're hoping that we can change that narrative. And the takeaway message at the end of the day, so if you leave now, at least you've gotten the import of this, is that we wanted to that moisturizing the skin of atopic dermatitis patients who reside in the tropics restores and repairs, improves the biophysical properties, the pH, the hydration, the transepidermal water loss, thereby reducing disease severity. Where's Dr. Renner? The importance of this was what you said at some point when you were like, Doctor, I think we said you should moisturize like 3 to 4 times a day. We're not just talking, it's evidence-based medicine. And the importance of it again in our environment is that we have a very, very hot environment, humid climate. Whether you like it or not, you will evaporate. So somebody tells you once a day is enough, we are saying, no, that's not what we find. But how do we make it nicer for the patients? How do we make it easier for them to deal with? How do we make it a little bit more convenient? It's the whole point, so that they can actually go away having taken something good. And you can see that the funding support was from Topicrem Pharma, so please give them a round of applause again. Thank you. So I won't waste time. I will not bother going into all of these things. But just look at the last thing. That whilst we say that studies of skin biophysical properties in A deficient reports reduce skin hydration, increase skin pH, that makes it more alkaline, and increase transepidermal water loss. That's what everybody says. And that moisturizing will reduce the pruritus and scratching that the patients feel. We generally do not have dermatology, approved moisturizer, that they are not usually tested in African settings. And if you see this picture there, this baby is scratching. I think this is what you normally see, Dr. Rodriguez. That is it. They are always scratching, and everybody in the house will think that it's your mother-in-law that caused the problem. Everybody's mother is another person's mother-in-law, so there's a problem, isn't it? So that was the aim, everything that we said. But look at this again. We took our time. It was a prospective, double-blind clinical trial on 140 consenting 80 patients. And we used them, they were in Louth and in Moscow. We registered this thing. We have the independent scientists who gave us the blinding, as it were. We have all the other players, like I said. We trained 2 research assistants who are our students. Please stand up and bow. Thank you very much. Look at them. You have to take them pictures. Yes? You have to take them pictures. Because everything is local. We're not playing. We speak our grammar. And what we did was that we measured whether they had the test or the control moisturizer at baseline, at 6 weeks, and at 3 months. We measured all their parameters, and we used disease severity, the EASY score, to check whether what we're doing was right. We only needed one single measure of the thermometer, which was a very, very good brand of, okay, I don't know what happened. I'm sorry. It wasn't me. Okay, maybe it was me. Sorry. So, all at every time, see, ambient temperature was controlled. Now look at that. These were the blinders, so you don't know who did this. Please, the person who did this, stand up. Who is the person that did the blinding? Stand up and show yourself. Thank you very much. That's our resident scientist in Louth. She was the independent scientist and she did the blinding. And we were not involved. This was the Courage and Kazakhstan MP and Dr. and so multiple probes, and that's it. So it's not focus, we did this thing. What did we find? I'm just going to skip. Moving on. I'm just going to move on as much as possible because everybody's tired. We found that at baseline, almost everybody was at the same time. They had very high pH. The skin was dry. 80 patients we know. But between 6 weeks and 3 months. So if you look at it now, we tested on the chin and we tested on the forearm. The chin is known to not be as bad. So to be that the forearm, the flexure, is where you tend to have flares of atopic dermatitis usually. So we tested their parameters. This was on hydration. We found that there was improved hydration with the test moisturizer. Just looking at it, however, when we subjected it to significance, it wasn't particularly significant. Okay? When we now check the trans-epidermal water, remember that we're testing against a known brand that everybody knows and everything is tested. It's usually like the standard. So if I were to ask you all, what generally is the standard moisturizer that we tell everybody knows? Anybody? Somebody? Okay, no? Vaseline. It actually was Vaseline. Shea butter is something that has come, recently. Everybody's trying to do more natural. So Vaseline. So we did use Vaseline. So our blinded product was Vaseline Intensive Care Lesion Repair. So that's something that is as close to the Topicrem AD bomb range, the DA bomb. And they look the same, white to white. So nobody's going to know the difference. So the patients were giving that. And skin pH, if you look at this again, so the orange is the test product, I hope you know what is orange and what is yellow, that's another thing. So this is the test product, and this is the control product. So you can see skin pH was reduced compared to the control. Alright, even more reduced. So 6 weeks, baseline 6 weeks and 3 months. So, and then at some point it now became, so this was at the chin, this is at the forearm. Reduced with the test, just slightly more with the control. And you can see that I just showed you, look at it again, significant. With 6 versus 3 months, it was significantly different. This was skin pH. So across board, skin pH reduced, which is what you want, isn't it? And with the test products. I just put this out there. Like I can speak a lot about this, but I know everybody's tired. I just want to put this out there that generally speaking, AD, we saw AD across all ages. Everybody says that AD is common in children. Yes, we know. But our dermatology clinic, we see both children and adults. And so that was a good place to test. And we saw that the mean age of the AD presentation was 24.5 years, plus or minus 19. All of you. And most people had mild to moderate, which is almost the same you see across the world. You do have severe AD, but they are usually fewer. But for those severe AD patients, you call in on them, and they are the ones that you now need biologics and all of the other ones. All of them baseline thick moisturizing. We found out again that the biophysical properties improved with continued use. Now this is underscoring, I don't know who asked the question, who said, after you use it for one time, then what do you do? And I said, no, it's a continuous thing. Somebody had asked the question earlier, I can't even remember. Because of the environment you're in, and because what you are giving is sort of the same environmental influence apart from the genetic background. So it is with continuous use. So you can't say, doctor, I was using this product, it's no longer working. Who hears that from patients' relatives? Thank you. I've been using this one. I've used all the different creams. It's no longer working. It used to work before. It used to work before when they started because they were listening to you and they obeyed. Then after a while, everything calmed and then they stopped, thinking it was a drug. So to pharmacists, to nurses, to doctors on the ground here, and to anybody who is here, even the students, because it's word of mouth. Social media is good, yeah, but I think word of mouth doesn't work. You need to let your patients, your friends, your families, and the people you don't even like know that you must moisturize. You have to moisturize, and it's a continuous process. That's where you will get it. So it wasn't just we did it and then it reduced. It was with continuous use. That's why use of either moisturizer improved disease severity, with more than 80% of difference in the EASI score. EASI is Eczema Area Severity Index at 3 months. So even if you continue after 3 months, chances are you can get the same results. That's the bottom line. So you did not see anything that was worsening because we compared it with something that was very standard. The test moisturizer was as effective at all the parameters, and it was actually now better, as I showed, which is why I called that on this, at lowering pH of the patients living in Africa that have AD. So in conclusion of that study, the tropical climate of Lagos where we live in may increase trans-epidermal water loss. Celine said she brought the rain with her. We don't always have rain, but when we have the rain comes very hard. Having said so, you know what happens here? With a little rain, people now wear hoodie and wear sweaters. I'm like, are you joking? But where is the cool? And the more clothing you wear, the more uncomfortable you become, then you scratch when you remove those things. So even the culture and the things you wear matter. So when you are counseling, put all of these things into consideration. It may increase chance of water loss and AD, but effective moisturizing reduces this loss, restores skin hydration, and lowers skin pH, which eventually translated to reduce disease severity and improve the quality of life. At the end, what we concluded, it wasn't just me, I'm just putting on behalf of the others who were all here, was that patients should moisturize at the very least once a day. And we're being careful about what we're saying. The Western world will say once daily. We say at least once daily. But twice daily may further reduce the transepidermal water loss, especially because we are in the prevailing humid weather. In those days when we were small, Harmattan weather, you would not even go outside. Before you go outside, your face has turned to ice craft. Nowadays, the Harmattan it's not really cold because of climate change, because of the environmental pollution, and the same environmental pollutants is what is changing the narrative of chronic diseases with atopic dermatitis in particular. The environmental influences on the skin actually have more impact than just your genetic background. Please, everybody must realize that moisturizing with whatever, I always say it and I'm repeating it again, the best moisturizer is the one that the patient uses and continues to use. Prefer hoping that it is not a bleaching moisturizer. Yes, that's very important. It doesn't have steroids, it doesn't have additives unnecessary, and it's not unnecessarily fragrance where you now start to have contact dermatitis. Thank you for listening to me. With these few words of mine, I'm able to convince you and not confuse you.
That's actually done at those debates, tournaments. Honorable judges, every time keep up, I could be that of I have not to convince you and not to confuse you. So that's the flow of things. So thank you very much. Round of applause, please, for Dr. Very interesting study. Like it, just it doesn't get better than randomized control trial except it's a meta-analysis, but the randomized control trial is as good as it gets. So it was blinded, very well conducted study. Moisturization. Again, I find out that sometimes with children, when you talk about how when people apply things to their skin, it's not peppering them, they don't feel like it's working. It's a real Nigerian issue, so that yes, it's hot. For ability to rub on that thing, it has to be hot. For children, I also find out that a lot of moms and grandmas, they really like the smell of the detergent. They want the detergent, they want the clothes to smell fresh, so they will add fabric softener, they will add all those things, and they all contain fragrance, and which I think tends to worsen the AD in some of these children. Does anyone have any questions on the presentation? So on the presentation that was just done on the study. All right, I know the days fast spent. Any questions? Oh, prices, the price. Okay. Oh, they mentioned customs. Which price again are you looking for?
You gave a quiz and we are yet to see. The prize.
Oh, the prize. Nobody won.
Oh, no. Then nobody won.
Okay.
Then what is the answer? Qualified by saying the one that they said was the #1 seller.
No, she said the one.
Oh.
I asked the question. Is it?
Okay.
Give me my answer. She was MCQ, technically speaking. So the point was, which was the right of the product that she invented had what to get to give us the product. She now said components. And I now qualified and said, yes, that is correct. So she didn't give me, I even gave it you should have called all.
Don't meet
I did my price.
Don't meet her in the exam. That's the lesson. That's the moral of the story. Don't meet her in the exam. All right. Okay. So thank you very much. Another round of applause for Dr. Kamini. So we are going to go to the vote of thanks now, and the vote of thanks is going to be taken by Aida and Sophie Kadek or Aurélie Picard.
is the end. Thank you once again. Thank you to all the speakers. Thank you for your time. Thank you for being here. And we hope that you learn more about Topicrem, our brand, our laboratory, and our 4 ranges for today. As I said earlier, we hope that we will increase our presence in Nigeria, and it will be thanks to all of you present today, doctors, pharmacists, and also our partner. So I will just leave Joseph say a few words, and on behalf of Mayoli, I'll thank you again for your time and presence today.
Once again, I would just really appreciate the nurses and pharmacists and today. And students, and look at the time, nobody costs to buy fuel. We're going to have fuel in this town now. It's a lot of money. And it's good money. So I really appreciate that. I'm really amazed with the turn of people I see today, the doctors, like I say. I will say thank you very much. And once again, we'll still call you again quarterly. And please don't be able to come. Maybe by that time I'll come to the better in terms of inflation and fuel will come down to 500 naira. So once again, thank you very much. Thank you.
Okay, so everybody that took part in the trial, please come forward for photo op. Everyone that took part in the trial. So blinders, medical students, researchers, so research assistants. Yes. So everyone, if you took part in the study, please come forward.
Hello everyone again. Please we're going to get some gifts with Topicrem samples, and it's very nice. So everybody will take it and be able to do some samples to the patient or our patient. Thank you very much.
Come, our leaders in the trial, my research assistants, you have to introduce yourself and say what you did. Dr. Cole Adeife is not here. She's one of the members. So I left that there so we can see the people that took part in this trial. You know, I don't know if you go, when you go to international, or when you even watch international things, generally we will say, you see the slides, show, yes, they say my team. So it's hard, but it is. Yes, thank you. Doctor, I think you will. So we'll do this. Yeah, no, they've done that first. They didn't take us. They got it.
Back to the trial.
Sorry to disturb us. Just want to send it to this side.
Now you see when I did and when you come. So when you come, you try to take my TV. Madam Ruth. And I just found it. If I trade it for you, if you go give away the phone, you do very much, maybe you go to buy and go home. Because they are called foreign products.
So thank you very much, everyone. I guess we can come in today. So the next Topicrem event is going to be in Paris, France, and so I'm going to expect all of you here.
Yes. No problem. Give us visa and what tickets.
I have to go. I don't give it to you.
Because every skin deserves to glow. Welcome to the world of Topicrem, brought to you by Juve Pharmaceutical Limited. For over a century, we've been the secret to glowing healthy skin in Nigeria, with a presence in over 40 countries and trusted by the Nigerian health and skincare market. Approved by NEFDAC, Our products are developed in line with stringent pharmaceutical requirements to give you the best care possible. Our range is specially developed to meet pharmaceutical standards, ensuring top-notch care for every member of your family. Let's dive into our fabulous lineup. Starting with our SPF 50+, it shields sensitive skin while delivering ultra moisturization, perfect for both kids and parents. Got rough or very dry skin? UR10 is your go-to solution, transforming your skin from rough to silky smoothness. Say goodbye to dryness with our ultra moisturizing body milk, offering 24-hour hydration and eliminating dry skin. Want to lighten and protect your skin? Topicrem is perfect for sensitive skin, preventing dark spots and enhancing your natural glow. For very dry and atopic skin, our DA Emollient Balm delivers intense relief and comfort. Babies deserve the best too. Our Ultra Hydratin Baby Moisturizing Cream and Sika Baby Rash Clearing Cream keep delicate skin soft and irritation-free. Cleanse with ease using AC Purifying Micellar Water, perfect for removing makeup and impurities. Boost your skin from within. AC Control, a powerful food supplement packed with burdock, nettle, vitamins, and zinc. Nourish and fortify your skin with Carete, leaving it smooth and radiant. Reduce flakiness and thickening with UR30, our anti-roughness soothing cream for flawless skin. Soothe your skin with Complex, our gentle and soothing micellar water. Pamper yourself with Dermo Regital, our ultra-nourishing body cream that rejuvenates your skin. Discover the magic of Topicrem, the brand that cares for your skin like no other. For more information, email us at sales@ijufpharmaceuticals.com, because every skin deserves to glow. Welcome to the world of Topicrem, brought to you by Juve Pharmaceutical Limited. For over a century, we've been the secret to glowing healthy skin in Nigeria, with a presence in over 40 countries and trusted by the Nigerian health and skincare market. Approved by NEFDAC, our products are developed in line with stringent pharmaceutical requirements to give you the best care possible. Our range is specially developed to meet pharmaceutical standards, ensuring top-notch care for every member of your family. Let's dive into our fabulous lineup. Starting with our SPF 50+, it shields sensitive skin while delivering ultra moisturization, perfect for both kids and parents. Got rough or very dry skin? UR10 is your go-to solution, transforming your skin from rough to silky smoothness. Say goodbye to dryness with our ultra moisturizing body milk, offering 24-hour hydration and eliminating dry skin. Want to lighten and protect your skin? Topicrem is perfect for sensitive skin, preventing dark spots and enhancing your natural glow. For very dry and atopic skin, our DA Emollient Balm delivers intense relief and comfort. Babies deserve the best too. Our Ultra Hydratin Baby Moisturizing Cream and Sika Baby Rash Clearing Cream keep delicate skin soft and irritation-free. Cleanse with ease using AC Purifying Micellar Water, perfect for removing makeup and impurities. Boost your skin from within. AC Control, a powerful food supplement packed with burdock, nettle, vitamins, and zinc. Nourish and fortify your skin with Carete, leaving it smooth and radiant. Reduce flakiness and thickening with UR30, our anti-roughness soothing cream for flawless skin. Soothe your skin with Complex, our gentle and soothing micellar water. Pamper yourself with Dermo Regital, our ultra-nourishing body cream that rejuvenates your skin. Discover the magic of Topicrem, the brand that cares for your skin like no other. For more information, email us at sales@ijufpharmaceuticals.com, because every skin deserves to glow.